Welcome to SNSCON Park. Let's heal and learn together. Today we are going to see a new topic. Let's see.
Good afternoon everyone. Myself Amu from second year B.sc Nursing. Today we are going to see about cerebrovascular accident, also known as stroke. Stroke occurs when the blood flow to the parts of the brain interrupt, and it is a medical emergency that requires immediate attention. So, stroke leads to causes disability and death in worldwide. The types of shock are ischemic shock, that is caused due to the blockage. Blockage when imagine this is a blood vessels. When the blood vessels have a blood clot, this blood clot leads to ischemic shock. 85% of cases are caused by these types of ischemic shock. So this is the type 1 shock. The type 1 shock is ischemic shock, where a blood clot forms in the area of the brain. So this is the thrombus. The blood clot is maybe is thrombus or embolus. So the second types of shock is caused by the rupture of blood vessels, that is called hemorrhagic shock. Hemorrhagic shock is caused by the rupture of blood vessels. Here, the blood vessels ruptures and blood comes out, so bleeding occurs here. So, here the hemorrhage occurs. And here the rupture occurs. And the third type of stroke is transient ischemic attack, that is a temporary blockage, often called as mini stroke. So mainly there are three types of shock. The first shock is ischemic shock. The ischemic shock is due to the clot of thrombus or embolism that occurs in the blood vessels, and the second shock is hemorrhagic stroke that occurs when the blood vessels ruptures and the hemorrhage occurs. The third one is transient ischemic attack, that is a temporary blockage in the blood vessels, that is also called as mini strokes. Here the next is the causes and risk factors. There are two types. The causes and risk factors can be two types. One is non-modifiable and the second one is modifiable. So the non-modifiable are age, gender, race and family. So these are the non-modifiable causes of the stroke. And modifiable is hypertension, diabetic mellitus, smoking, alcoholic, etc. So the signs and symptoms of shock is sudden numbness or weakness in one side of the body, and confusion, troubles in speaking and understanding speech, and also the patient have visual disturbance, loss of balance in the one side. There is a mnemonic that can easily be got from stroke is face. Face, fast.
Hello everyone, so I am myself Yazhini pursuing B.sc Nursing second year, and I am going to continue on the pharmacological management of stroke. So when stroke comes, what are the pharmacological management that we will see in the hospital settings are, the medications are anticoagulant medications. So anticoagulant medications are nothing but when stroke occurs, it occurs in one of the types due to an emboli or a down by this anticoagulant. So there won't be blood clot. So this will break down the blood clot so that the blood flow is restored. So the next one is antiplatelets. So antiplatelet is nothing but blood thinners. So this will help the blood to, so the thickening of the blood will be prevented. So the blood flow is better to the brain. The next one is antihypertensive. So normally when blood pressure is high, the blood flow will be increased in all the regions as well as the brain. So when we give anti-hypertensive medications, this will reduce the blood flow and blood pressure will be reduced. So the blood flow will be normalized and the stroke can be prevented. So the rehabilitation therapy. So once the stroke has occurred, so the patient will be gone into rehabilitation therapy. So there are two types. One is physical therapy and the next one is speech therapy. So next one is prevention. How can you prevent stroke? So stroke can be prevented by controlling blood pressure and cholesterol. And the next one is you can quit smoking and healthy diet and regular exercise can be done and regular health checkups can be done and managing diabetes. So if you are a patient who have diabetes, you have to manage all this blood pressure, cholesterol and all other conditions. So to conclude, stroke is a serious medical condition that can lead to also death. So this requires urgent care and early recognition and treatment will help to prevent this condition and restore life. Thank you.